thanks for this opportunity. Just a little bit about IntraHealth. IntraHealth is an African-based software company that is focused on advancing imaging healthcare through the use of technology, which ultimately brings imaging care to the people of Africa and beyond. We don't just talk about it, we actually do it. For most of us as industry leaders and decision makers, when it comes to IT and software, word software is mentioned, and straight away we call for our IT departments. The presentation that I'm going to give is nothing IT orientated. It's just really the practical approach of using great technology in rural areas. So before we continue, let's consider ourselves. How fortunate we actually find ourselves when it comes to access to healthcare, and we really take it for granted. We wake up in the morning with a cough, generally after a few days of coughing, continuous coughing, we phone for an appointment and we get to see a doctor. Generally the same day, if we require x-ray, we have an x-ray taken and we actually even get the result. This is really a privilege that we must not take for granted. Now let's take Africa. 70% of our people basically stay in rural areas. They don't have access to facilities, ease of use facilities, there's a lack of infrastructure, limited medical practitioners, and generally in these outlying areas there's no specialists. An occasional specialist may attend the district hospital. So the practical example, here we have Tendeka. She stays in rural Africa. She's a mother of 3 living in a remote village, and her husband's a migrant worker. Some months after attending a community gathering, she develops a persistent cough. As the weeks go by, her strength starts to fade and she decides to go to the district hospital, which is some 20 kilometers away. She has to walk, not like us climbing in a car. So after a couple of days, she gets to the district hospital, etc. And at the district hospital, crowded waiting rooms, which we've all seen from time to time. She has to wait many hours to get to see the doctor. She's examined, and concern exists that she may have contracted TB. Tendeka is then sent for an x-ray. Once again, she waits in a crowded waiting room. After having the x-ray, she returns to the doctor. The doctor is unsure. Although he may have been trained to identify TB, he's unsure of the diagnosis. He then says, okay, we need to send this to the regional hospital, but Tendeka, you're going to have to wait 5 days for a result. And we've experienced this throughout Africa. So up until now, we can say, yeah, sure. What's this got to do with technology? We can't change those infrastructures, but we can change the procedures from the hospital. So, bringing it back to the point on technology and how technology can bridge the gap of bringing healthcare to the people of Africa through use of an enterprise imaging platform similar to that of which IntraHealth has. X-rays are taken in rural areas and can be sent securely, which was mentioned in earlier speeches, to specialists anywhere in the world for reporting, even over basic cell phone connectivity. And the emphasis is cell phone connectivity. What we have to state is data can be moved, but it's the quality of data that we're interested in. So what is presented must be presented to the doctor in an outlying area. So back to our story. There we have Dr. Yokona, and we actually are in business with the Dr. Yokona. He was the first Zambian radiologist to qualify many years ago. So he studied for 10 years. He wishes to give back to his community, but he lives in a city where the demand for his services are much more concentrated. It is only through the use of technology that Dr. Yokona can actually access Tendeka's X-ray. It is with the deployment of the IntraHealth solution that Tendeka's X-ray is now presented electronically over limited mobile connectivity from the district hospital to Dr. Yokona within minutes. We've actually experienced that in cases like Tendeka, where the system has been implemented, it is within hours that you can actually get a report, not days. It's the quick turnaround times that has the direct effect on the well-being of Tendeka and those waiting in the same crowded rooms for the reports. So we've got the technology, it exists. We've got the connectivity, it does exist. Cell phone connectivity is spread throughout the continent. Medical practitioners exist. So basically advancing healthcare should not be a problem. Well, we can all agree that the above is a great solution and turnaround times are greatly improved. It doesn't actually solve the problem of healthcare that we face. We at IntriHealth has not stopped with this, our development, and after considering various factors such as population growth versus medical specialists, we realize that the health sector is constantly going to be on a back foot. With this in mind, we have partnered up with some pattern recognition scientists to develop an artificial intelligence detection algorithm, and the emphasis is on detection, not diagnosis. Today we're proud to announce that we've actually got our algorithm for TB, our artificial intelligence for TB. We're currently getting 95% accuracies on detection of TB, and this is done within seconds. So let's go back to Tendeka, our story. Let's assume that the district hospital had IntriAid for TB to assist in the determination of the probability of her TB. Tendeka's chest X-ray would have been taken, it would have been processed through the algorithm to determine the probability of her TB. Should the results have shown a high degree of probability, Tendeka could have been separated from the crowded waiting rooms. At the same time as doing that, we could have prioritized the study to Dr. Yokona to get it reported earlier. And this has a great impact on the greater community. So advancing healthcare to the people of Africa is possible. So let us bridge that gap. What I'm going to take you through now is, in actual fact, an online demo of how the artificial intelligence for TB works. So the X-ray is taken, digital format, sent over effectively a cell phone signal into a cloud. It can be sent from anywhere. On this example, we're just assuming that we've got the studies. We click on it and we say, okay, where are these studies? So here we have the studies. So we just select one, and you can see, using the signal, that it's been uploaded. You can select on chest detection for TB and classified. So it's running through the algorithm, etc. The results will pop back shortly. There we go. There's the score. So in this case, chest X-ray, it's the same study, 99% normal. The beauty with this runs in the background. What I've just done now was just to demo it, but in the background it will automatically feed through a detection program. The outcome comes through, and that's it. I mean, we're going to choose basically all of them just to demonstrate. What's interesting, this solution is currently running out of the States. Because they finished the algorithm this week, so the solution will come to South Africa. So there it is. We've got all our studies. TB scores 97% at the bottom, TB 86%, we had a normal of 70%, 99% and 98%. So this is the future. As the regulations start changing and more tests are run, I believe diagnosis will be done with artificial intelligence in time, but it will only be in time to come. Thank you very much.